Thank you for staying with us on TVC Breakfast. Well, the federal government has now given a directive refraining or restraining health workers from applying for a leave of absence and then using that opportunity to leave to other countries in search of better offers. Minister of State for Health, Dr. Tunji Alausa, noted that the ban on the leave of absence for health workers emanated from the executive order issued by President Bola Tinubu as part of drastic steps to combat the challenge of brain drain, called popularly known as the jackar syndrome, confronting the nation's health sector. According to him, the annual enrollment of nurses, which used to be about 28,000, had been increased to 68,000. He added that by the end of the year, it would have gone up to 120,000. He also said President Tinubu acknowledged the people as the biggest assets of the country and had vowed to take proactive measures to improve the health sector for their benefits. That's what we will be treating now. We bring in, joining us via Zoom, public health physician and health promotion specialist Obinna Eberim. Thank you for joining us on TVC Breakfast. Good morning.
Yeah, good morning.
Right. So what are your thoughts on this latest policy, this kind of intervention by the federal government to curb brain drain? The latest, as you must have been following, is this directive stopping the application of leaves of absence for health workers in the country.
So thank you. I think that it's important to think of why are people leaving before you then find out a solution. Most times in public sector, we use a linear approach to solve problems. So we think that maybe if we put an executive order and people will then stop leaving the country. But public sector problems are what we call wicked problems. Now they are wicked because there is no one linear solution to solve them. You have to use a systemic approach that entails first understanding the problem and using multi-sectorial, multi-faceted approach to solve it. So why am I saying this? The problem why people leave this country or apply for leave of absence to go and test the waters, because usually what happens is that if someone applies, someone maybe is not quite sure if he's going to get a better life out there. So he applies for the leave of absence and then travels to a country, and then usually most of them then stay back because then when they compare what they are earning here and the quality of life, they would then tend to stay back. So it's important that we understand why are people leaving and then solve those problems, use a multifaceted approach. So one, it's okay if government put an executive order to prevent people. So if you want to leave, you leave. But then there's also a negative consequence because there are some people who genuinely want to maybe travel to impact knowledge, maybe an exchange program that will at the end bring in maybe opportunity and revenue for the institution they work with. So those people will be affected. Now, the main reason why doctors, nurses, pharmacists are leaving in their numbers is because of first of all, we don't prioritize health as much as we should. The funding of health is so low. And about over 10 to 15 years ago, we gathered people here in Abuja and said we are going to increase our budget for health to 15%. We'll not achieve that. The net effect is that our health workers are low, are one of the lowest paid. And you have a situation whereby even the demand is high. So if you use the law of supply and demand, we have a ratio of 1 doctor to 10,000 as against WHO 1 to 600 to between 600 to 1,000. In the population, one doctor per about 600 to 1,000. So the demand is high, but the pay is low. So it's just natural that the law of demand and supply, people will then, if you are not paying them well, people then look for where their services are sought after, that they will have good pay. But beyond good pay, it's not just only about the money. It's about the enabling environment, right? So doctors, the health insurance coverage of this country is still low. And as doctors, when I did my housemanship, I had scenarios where as doctors, even doctors are just graduated and are doing their internship, we had to contribute for some patients who cannot afford health care, right? And that puts strain on your little resources. There are situations whereby you want to do an investigation or you want to do a treatment and you find out that either the tools are not there or the patient cannot even afford the best drug, and you have to then think, okay, which one will I give based on? So all this is a bit frustrating for a health worker who is practicing in Nigeria. And then the broader socio-economic situation. You proud yourself, I am doctor this, I am pharmacist this, and you have to still live in a society where your salary might not be able to afford your children the best of schools, right? Where you have to literally build your own house, pay for a borehole to get water, even have to pay for a security guard to guard your house, and maybe if you have to go to your local community, you have to pay. So there are a lot of environmental and social factors that are even putting a drain on that scarce resources. So if we have to solve this problem, we have to look broadly at all the problems and then sit together and find a way we can solve this problem. It's not going to be a quick win. It's something that we have to start today. But then you have to create hope. So doctors, nurses, pharmacists, health workers will see a hope that if I bear the pains and stay back, in the next 5-10 years, my quality of life will be better. I will have a good environment where I and my family can live and thrive.
All right, Mr. Ibrahim, I actually agree with you on the issue of enabling environment for medical practitioners to thrive, and not just medical practitioners, everyone to thrive. But if you are saying, talking about testing the waters, in other disciplines, once you want to move from one country to another, you want to jackar, you have to resign. Why should it be different for health workers who are going to test the waters? Why don't you just resign to take your appointments?
So as I mentioned earlier on, the policy in itself, it's not bad, okay, but then you need to look at the merits and demerits. So for those who are genuinely, I would say greedy, they want to go and earn there while still maintaining their salary to earn, that's a good policy. We have to also know that there are some people who genuinely leave because of maybe they've had like a 3 months opportunity out there to go and maybe build capacity, transfer knowledge, gain skills that they will come back and apply, right? So those people will be negatively affected. And that is why it's good that before you put up any law policy, you have to weigh the consequences.
But right? You should, Mr. Ibrahim, you should understand that. I'm sure you understand that the government is trying to curb this issue of brain drain. Over the years, we've had several medical personnel leave the country, and we have seen the impact it has had on our medical facilities in Nigeria, of course, and we are seeing the situations whereby medical experts are tired because one person is catering for over 1,000 or so people in the medical, coming for medical checkups and all of that. So even if you're going to, for 3 months, you have a situation where you have to go for 3 months, that should be stated, don't you think?
So, as I mentioned earlier on, this policy in itself is not bad, but the question I think we all have to ask ourselves, will that, in its true sense, called the jackar syndrome in Nigeria? It's something that it's good in terms of ensuring discipline in the workplace. But if you're using that as a solution to prevent jackar, I can assure you that that will not work because that's not the root cause. So, for example, let's think of increasing maybe hazard and allowance, or let's even leave hazard. Things like in the past, when doctors are employed, right, they are given a place of residence, they are given a car. You know, some of these financial institutions, they employ someone for the first 2 months, they give them perks that if you have to resign, you think of those perks and then it increases your stay, right? So think of that solution and this solution. What I'm saying is that it's not that the policy in itself is bad. I want to put it out there clearly. It's something that ensures discipline. But one is that we have to think about the merits and demerits and see how we can solve for those who are genuinely taking the leave of absence. So maybe, as you rightly said, you have to put the reason clearly, not to say I'll ban, nobody should. Or you put the reason and maybe get some level of authorization from where you're going to, right? So that in itself is a way to design a policy to ensure that you're ensuring discipline in the workplace, but you're not jeopardizing an opportunity for maybe capacity building or skills transfer, right? But then, if you talk about this as a solution to jackar syndrome in Nigeria, as a medical doctor, I can tell you that it's not a solution. It is not, it can contribute, but it's not something that will bring a big change, because at the core of it is the pay, the quality of life, the enabling environment, right? And if you don't fix all this, If you don't fix all this, people would resign. Yesterday I was in a group where the news broke out about the British government banning people bringing in their spouse or their dependents, right? And in that group, we had a lot of medical doctors and health professionals. What they said is, this one, I will go and find a program for my spouse, and that would still solve that. So the problem is that if you, before you put up a policy or a change, right, think about what is the root cause. And my take this morning is that let's begin to address those root causes. Can we increase our funding for health? Can we put up things that make health workers' working conditions better? Can we improve our health system so that we have a situation whereby health workers have, even if they are not well paid as their counterparts outside, but they are working and they feel that fulfillment, they're able to make the right diagnosis with the right tools. They don't have to start contributing for patients who have to pay, because patients are likely covered by health insurance. By the time we fix some of those systemic issues, we'll see that more of our doctors are staying. And then over time, we can increase pay. And you also, while increasing pay, you have to think about the consequence in other sectors. So would it be important, helpful to leave the pay and increase the Harvard allowance? You want to concentrate more pay for those working in rural areas where you have the PACs to encourage more people at the rural areas. So these are some of the things. There's not really one way to solve this problem. We have to do I would say, a bouquet of solutions that would help cope with jackar syndrome in Nigeria.
All right, and of course, in addition to what you just mentioned, because that was a question that we had also reserved for you, your thoughts on the UK's new position now that health workers coming in from other countries cannot bring their dependents. The UK also went on to talk about health workers who have had their fingers burnt, so to speak, with fake job offers, non-existent job offers, and the like. It gives an impression that, this problem, appears to have, a global dimension. I wonder what your thoughts are. Of course, the average worker has a right to, move freely in between jobs. But doesn't this also kind of expose health workers seeking greener pastures to dangers?
So I think that the UK government are making laws that suit their context, and I won't. I think they are battling with the population, and then also trying to solve their problems, filling the health worker gap, while not making sure that the other jobs that have enough skill in country are not maybe stretched, or I would say foreigners coming to take it. So I think that's why they did that policy, right? So I think that I wouldn't say that I'm a Nigerian. I wouldn't say that I would be here and dictate for them. But what I know is that it's going to, in some way, reduce people leaving, because as health workers, we also want to have a good work-life balance, right? And if you're going there to maybe school and then look for greener pastures thereafter, if you consider that you're not going with your spouse or your family, you might then begin to reconsider. Because as one thing I forgot to say is that some health workers who leave this country, it's not just about themselves, it's also about their family. Because sometimes when you get there, your children have better quality of life, better quality education, and maybe health care, right? So I think that with such policies, as I said earlier on, this is a call to say, government, now that I would say the UK has added something that would reduce that movement of health workers and maybe some of your best skills beyond even health workers. How do we now improve social amenities such that when people then consider, they will then stay back, because then they see that if I'm not going with my family, and my family here can have better quality education, better health care, then the incentive to move abroad is low. And you see people then reconsidering their move. So I think that's what I would say for that. It's an opportunity that we as a country need to then take advantage of, to then improve at least the quality of life, education, healthcare, that people will then find better reasons to stay back and stay closer to their family, but then their family is enjoying good health, good education, and living in an environment that is safe.
Okay, so even with even if the federal government has to or implement all you have said for the health sector, do you think this will reduce the jackar of health workers? Because the UK has put a peg, and so there are other countries who might want health workers and want to pay more.
So yeah, I think so. If you look at the last World Cup, right, you know that Nigerians are very patriotic people. Nigerians are really very patriotic people. All they need is an enabling environment. I can assure you that if there is an enabling environment to thrive in Nigeria, or there is hope. So there's something that the things might not be good today, but when you maybe look at the economic plan of the government and look at some of the processes they are putting in place today, you can forecast that in the next 5 years, things would there'll be light at the end of the tunnel, right? You would see that even with greater pay, Nigerians will stay back. Nigerians will stay back. It's not easy. I can give you another example. I belong to a WhatsApp group with my classmates. We graduated together from the uni, the medical school. And sometimes conversations go and people then talk about their pay. And you hear that people out there are earning 5,000 pounds or $1,000, right? And then you think about your salary as someone, maybe a reg, a junior, a senior reg, or even a consultant in Nigeria, and you're earning maybe less than a 600 or 700 or 400,000, right? So the temptation is huge. It takes someone who is very patriotic, and I know that Nigerians are patriotic. All they're asking for is an enabling environment. All they're asking for is some of those perks that would really show that their effort is being appreciated. And there are some learnings, as I said, from other sectors on how they retain their skill. Can you provide, as I said, housing, maybe a car for doctors? Can you increase their hazard allowance? Can you put some bonuses for those working in rural areas? These are some of them. Also, you have to increase your absorptive capacity, right? Strengthen the health system so people do their work and do it well. Be able to practice what they learn in school and not applying, I would say, maybe doing things just to make sure they get over it, since the tools and the technologies they need to make those diagnoses or treatment are not there. And then you improve your insurance uptake so that most people are covered by health insurance. So doctors, nurses don't have to dip hand inside their resources to pay for some patients who are unable to afford their healthcare. And these things are real. If you go to the hospital, you will see there are some people that you treat, and after treating, they can't pay, they stay back, they get nosocomial infection, they stay back. By the time you just get tired, and nurses and doctors have to contribute to pay. How much is our salary that we pay? So these are the real frustrations out there. And it's only when you are in the system you understand this frustration, and then you are now under pressure by your colleagues outside who are earning so much and then don't have to go through this as well. So those are the real problems.
The President has said through the Ministers for Health that there would be on a drive to increase the number of health personnel in the country, not just doctors, nurses, and the likes. It's also coming at a time when we are told that the enrollment of nurses in the country has also spiked from 28,000 to 68,000 and counting, and is expected to reach as high as 120,000 before the end of the year. What do you make of these revelations?
So I think that that's a welcome development. As I mentioned, it's important to solve from various angles, like using a multifactorial problem. So yes, increasing the number of doctors and nurses and pharmacists who graduate, it's one way. But then we have to match that by increasing the absorptive capacity, because you have a situation whereby you graduate a lot, people are struggling to get a place to do maybe internship, housemanship, and once they try the first time or the second time, the next thing is that you're writing the USMLE or the PLAB to move, right? So that's a good decision. Increase education and the training of health workers so that you have a good tool, right? But then it's also, how do we increase the absorptive capacity, right? How do we ensure that communities have access to health care, and the health workforce is well motivated, well remunerated, right? Then be able to get these people who are graduating interested to stay back. So I would say it's a good decision, but then there are other steps. As I say, most public sector problems are wicked. There's no one solution. And also, when you solve with one, think of what are the merits and demerits, because a solution will likely come with some merits and demerits. But if you're solving for it to say, okay, if I increase the number of people graduating from medical schools, from nursing schools, and all that, what would be the merits, or what are the problems I then have to face going forward? And that problem is, how do you then absorb them into the system, right? How do you absorb them when they graduate? Because then, if you then graduate a lot and you can't absorb them, then it's like you're putting a lot of money, investment in education, but then you are losing it for people living around because you're not able to absorb it. So we need to think broadly. We need to solve for the multiple solutions that will then contribute to retaining our best skills and workforce.
Okay, so earlier you had mentioned that there should be an increase in the hazard allowance because, excuse me, we're aware that the president had increased hazard allowance last year from grade level 1 to 5, was reviewed upward from 5,000 to 10,000, and from grade level 6 to 16 was increased from 18,000 instead of 10,000 naira. But you are asking for an increase. If you were to advise the government on the appropriate amount for health workers as regards hazard allowance, what will that be for you?
To be very honest, I don't have all the factors to make a prediction here, but what would guide my decision and what are those data points I want to look at before I come up with a figure would be, let's consider what would bring our health workers remuneration closer, not the same, because obviously we don't have the same economic strength and all that some of those countries. But what would bring them closer and discourage? What is also an appropriate increase that considers the inflation, what you can pay or buy, right? So, for example, if a doctor in the past was buying, maybe have to transport to buy a fuel of maybe 20,000, right, for a week, depending on where he's working. Maybe a doctor living somewhere in maybe Wuse area and then have to go to Babalada, where you have the teaching hospital, and maybe he spends like 20,000, right, on a moderate car, and then because of the cost of fuel right now, he's not spending 40,000, right? You would see that increase have just been swallowed, right? Or a doctor who has been considering whether to leave, and at a time when maybe the naira was maybe 700, 1,000, but now the dollar is about 1,500 or thereabout, you would see that doctor would think of the earning power he would get if he travels abroad. So those are the concepts. So these are the factors that I will put in place and then come up with a figure. But it won't be in the range of 10, 20, 30. It should be something greater that then considers all these factors.
All right. So maybe on a personal note, if you can, share, with us, what is holding you back from taking the route of, your peers? Because we've had, some people, for the love of country, choose to stay back. Is that what it's like for you?
So just to tell you that my wife wants to be jackar, she's a pharmacist, and I'm holding. so for me, I need to be very honest here, because it wouldn't be good just to come to TV and then try to appear good, right? The being patriotic is there, but then I'm now more into public health and not the clinical health I was trained, right? And to the glory of God, I'm able to get a good remuneration, right? And be able to consult for some organizations outside, which then pays me in those currencies. So when I put all that together, it's not shocked. I'm not shocked by maybe the inflation or the naira the naira changes. So honestly, that's why I'm not thinking. So when I'm in the WhatsApp group of colleagues and they're talking about their salary, I then look at, okay, what's the cost of living and what's their next take home? And if I stay back in Nigeria with what I'm earning and I'm not having to spend so much on rent, on other things like tax and all that, right? And I have something, not as much as them, but something that is not enough to make me think of leaving, given also my love for Nigeria.
All right, so it means that you're taking advantage of remote work to make some more.
And that's an advice.
That's an advantage.
That's also an advice for, that health worker who may just be watching. All right, Obinna Ibirim, public health physician, health promotion specialist, we thank you very much for speaking with us on TVC Breakfast and wish you the best in your endeavors.
You're welcome, and my pleasure being here today.
All right, we take a break now to come back to